Dr. Raghuram Sethi. He is the youngest oncoplastic surgeon who was conferred with the Padma Shri by the Honorable President of India in 2015. He is youngest surgeon ever from the Telugu states, conferred with the prestigious Dr. B.C. Roy National Award by the President of India in 2016. This is the highest award that can be achieved by a doctor practicing in India. One of the very few in the world to have obtained FRCS from all the 4 surgical royal colleges in British Isles. Dr. Raghuram's motive is to spread awareness about breast cancer and pink connection in the government and non-government bodies. Million Moms is honored to have Dr. Raghuram Sethi present here with us today. Dr. Raghuram, despite your very settled status and a lucrative career opportunities in the United Kingdom, you were working there, you just suddenly came back to India, hearing to the news of your mom who's diagnosed with breast cancer. Could you please share this experience with us, the turning point in your life?
Sure. First of all, I must thank Dr. Mani Pavitra for giving me this opportunity. And as I was leaving home today, I was telling my mom that I was participating in this panel discussion, and she was very happy. So I've taken her blessings and I've come here. So yes, I was in the UK with my wife and my children, and I had settled status. I was working at the Royal Marsden Hospital, which is the world's oldest cancer center. So I was the only Asian there as a consultant. My wife was about to get a job as a director of a fertility center in Harley Street in London. So we had everything going for us. We were just about to buy a house, a large house with a swimming pool and a tennis court. We bid for it. And, I never had any intentions of coming back to India. So when my parents came on a holiday in 2002, to cut a long story short, my mother was diagnosed with breast cancer. So being the only child for my parents, it was a very big shock for me. And whilst I was inquiring about the treatment facilities, the care, the breast cancer care in this country, in our country, I realized that breast cancer is not a priority. There is very little awareness, and majority of breast cancers in our country present in the advanced stages. There was no concept of a dedicated breast health center which manages not only breast cancer but benign non-cancer issues, because benign problems are more common than cancer. And most importantly, counseling, which is supposed to be the most important component of healthcare, particularly cancer care, was non-existent and is today also non-existent. It's not even part of our medical curriculum. So doctors spend few minutes with patients, and there's very little counseling, because without counseling, which is the most important component of cancer care, whatever treatment is given, it doesn't work. So recognizing all these things, my wife and I took a paper and wrote down what are the pluses of staying in the UK, what are the minuses, what would my parents do, how will I look after my parents. And I have to give full credit to my wife, Dr. Vaijayanti, who stood rock solid behind my decision to return to India. And that decision is certainly the turning point in my life, because Lord made me realize through my mother's illness that no matter what I am abroad, no matter whether I have a settled status, lots of money, it really doesn't matter. I'm meant to be in my motherland. I'm meant to be with my parents, and I'm so happy that I am able to look after my parents. I'm able to take their blessings each and every day when I go to work, and it is their blessings that has helped me reach this far.
That's wonderful. I just wanted to know how far the lifestyle changes would really have an impact on the reducing the incidence of breast cancer among mothers, especially women.
Yeah. Breast cancer is a tsunami. I'm sorry to say, I don't want to frighten people, because there's a fine line between advocacy and frightening people. I don't want to frighten you. But breast cancer is the most common cancer affecting women in our country. It has overtaken cervical cancer to become the commonest cancer. And what's more alarming is, as opposed to the West, where we see breast cancers over the age of 50 years, in our country, the peak incidence of breast cancer is between 40 and 50. And lifestyle changes, in fact, breast cancer is a lifestyle disease, like many other diseases like diabetes, hypertension, breast cancer or cancer in general has become a lifestyle disease. And particularly for breast cancer, lifestyle changes like late marriages, not having children, having the first child after 30, not breastfeeding, obesity, all these things are risk factors for breast cancer, because any factor that increases the exposure of estrogen hormone for a prolonged period of time on the breast can cause breast cancer. So estrogen is also produced in the fat. So if women are obese, there is a slightly increased chance of getting breast cancer. So yes, lifestyle changes have a role to play in breast cancer, and breast cancer is a lifestyle disease at the moment.
Doctor, if you have to say something to the mothers over here and also the mothers who are listening and watching this program, what would you say, especially with regards to breast cancer? How careful they should be and what steps they need to take?
I think we should follow what Dr. Mani Pavitra is doing. I think we should lead a healthy life. But above all, we can't prevent breast cancer as such. Science has not progressed to such a stage where we can prevent breast cancer. If we have to fight breast cancer, there are only two ways. One, women of all ages. I repeat, women of all ages. It doesn't mean a young woman doesn't need to worry. Women of all ages need to be breast aware. That is, if they notice any new changes like a painless lump in the breast, a recent indrawing of the nipple, blood-stained discharge from the nipple, recent puckering of the skin overlying the breast, they must not ignore. They must go to a specialist. So important to be aware. Second, women 40 and over must have a screening mammogram, because screening mammogram is an X-ray of the breast. It's not painful. It does not cause radiation hazard, as some of you may think. But by getting a screening mammogram done once every year from the age of 40, at least once in 2 years, we can pick up breast cancers very, 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 very early. So early that before the lady or the doctor can feel it, it can be picked up. Because many cancers in general are not detectable early. For example, lung cancer, pancreatic cancer, stomach cancer, you can't pick it up early. Whereas breast cancer, cervical cancer, oral cancer, you can pick it up early. If you pick up cancers that early, you can say that you can effectively cure that patient. One doesn't need to have expensive treatments, toxic treatments like chemotherapy when you pick up an early impalpable breast cancer. And more importantly, one does not need to undergo a mastectomy or removal of the breast. You can conserve the breast. You can get the breast reshaped. Of course, it can even be done even when there's an advanced breast cancer with latest techniques. But with early breast cancer, it's possible. So therefore, the message is early detection. Early detection saves lives, and you must be aware of any new changes, and you must not ignore. And as Mother's Day is coming, and India has many festivals, so the men in the audience, instead of buying a sari or an expensive gift to your spouse, to your sister, to your mother, to your grandmother, please gift a mammogram. You may do the other things, but also gift a mammogram. That will save a few people's lives, and hopefully in the fullness of time, it will save many lives in our country.
Finally, Doctor, in our target to achieve the Million Moms target, to see that there are million mothers, millions and millions of mothers to lead a happy and healthy life, in which way can you contribute to this?
Surely, I'm very impressed with this initiative. I always believe, and I'm sure all of you believe, that a woman is the nerve center to the family. She is the nerve center. If she is healthy, if she is happy, health and happiness will radiate in the family. And I think the initiative that Dr. Mani Pavitra has taken up, from my point of view as the CEO of Usha Lakshmi Breast Cancer Foundation, I would offer my time and all the facilities that we have, including the audiovisual facilities which are used nationally by the Government of India, to create awareness, to empower people, and to participate in webinars and contribute towards empowering women about the importance of every aspect of breast health in simple, easy to understand language. In fact, we already have an app which was launched by Mr. Amitabh Bachchan last year in March, which has information about every aspect of breast health. It's called ABC of Breast Health. You can download it for free. But I'd be very happy to participate in any way that you find you require.
Yeah. Thank you so much, Dr. Raghuram. Incidentally, we are very, very happy, and we are to share this news that he is also the advisor of Million Moms. Yeah.
The 21 days challenge. Log into www.millionmoms.in. For more details, contact 77024 9110.